Good day, Virgin Islanders, at home and abroad. I just want to say happy holidays and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of December 27, 2021. Joining me this afternoon is the Health Commissioner, Justa Encarnacion, for the latest COVID-19 data and information on where Virgin Islands residents can get a free COVID-19 test, vaccine, and booster shot this week. But before we go to Commissioner Encarnacion for this afternoon's update, I just got off the phone with President Biden, Dr. Fauci, and the nation's governors, and where we had a briefing about what is going on, certainly in the U.S. and nationwide. And it is timely because we are experiencing the same alarming rise of COVID cases here in the territory. And it has taken place essentially in a matter of days. With everything that we know now, this is a very highly contagious variant, the Omicron variant, and it is spreading worldwide. The evidence is clear that it is here amongst us in the territory, whether it's verified or not. And as of yesterday's EPI report, we now have a total of 544 active cases. That's 544 active cases and a 7-day positivity rate of 11.6%. That's of yesterday. For a comparison, just to put it in perspective, last week's briefing, I reported to you that we had 72 cases and a 7-day positivity rate of 1.6. We have seen an exponential increase in a matter of days, and this is the highest number of active cases we have seen in our almost 2-year response to this virus. And it's nothing that you're doing. I certainly been out for the last 90 days or so. We've had minimal COVID-19 cases. We were dealing with the slowdown of a surge in St. Croix and in St. Thomas, St. John district. Virtually any cases at all, so not much has changed. The great thing that has changed, though, is this virus. And believe me, today, I am just as frustrated as you in having to continuously come back. But it's nothing that I have done, and it's nothing that you have done. It's just that we continue to deal with this global pandemic that is just plaguing us and continues to plague us nationwide, worldwide. And we have to do the things necessary to deal with it. For those of you who have been fully vaccinated, now is the time to make sure that you go out and take your booster shot. I did so last week. I was procrastinating, probably like some of you. Just go out and get the booster. We are keeping, and if you haven't been vaccinated in the first place, it's still time to do that as well. You can go and get the J&J. One shot does the deal. So we're keeping those community vaccine centers open to make sure that you can go and get your booster or your vaccination. Commissioner Encarnacion will provide more information regarding the testing and vaccination locations other than there. So if there's any good news at all, while we are seeing breakthrough infections, we are at least encouraged that the recovery rate has been quick. And as of today, the hospitalizations rates are very low here locally, as well as nationally compared. I think in the call we just had, it is 50% lower in hospitalization than this time last year. However, we have seen an increased surge in our emergency rooms and our local urgent care centers. So people are going to the emergency room with high fevers. If you have a cold, you probably have COVID. This one manifests itself a little different, so just stay home. This is one time when home for the holidays has special meaning. Just stay home. We are also seeing an increase in the lines for testing. And our main concern here is always, Dr. Fauci emphasized it on the call that we just had, whether in South Africa or in England, Europe, what they're seeing is this is a milder version of the Delta variant, so of coronavirus. So people are not getting as sick, especially if you're vaccinated and you have your booster. They are breakthrough cases, but those people are not having like rash symptoms, usually aches, fevers. Some people have reported vomiting, but it's manifesting itself differently. So in this time, while we are alarmed by how many cases we have, the real indicator is how many people are being hospitalized. So if you're feeling sick, do the regular flu regimen and taking care of yourself. And if you feel that you've been exposed, just stay home. Home for the holidays. That's our theme this year. Just stay home, avoid other people's, and get tested when you can, and avoid exposing to others. Remember, if somebody exposed you last night, you were exposed to the virus, you're not going to get tested positive today, more than likely. Wait a day or two, stay away from people. If you feel sick, then that's a different story. You can go and get tested to verify it. So what we're trying to do, and I always stress, getting COVID isn't the problem. The vast majority of people get COVID, recover, and they're fine. Getting hospitalized and dying from COVID, that is the problem. So what we're trying to do right now is just slow the virus, because it's starting to impact a lot of our government offices. Even though we've been closed for the last 4 days, people have been calling and we've been checking. So I've authorized our agency heads in central government to allow the government workers who can work remotely to do so starting tomorrow, December 28th, until Monday, January 10th. So if you don't need to be in the office, you work for the government, central government that is, I'm sure other agencies will be putting out those notices, because I'm asking them to do the same. You don't go into the office. This week is a 3-day week. Next week is a 4-day week. So there's not a lot of time that's going to be lost, and it's going to benefit our community. So we're also asking for the public's patience and understanding as we try to slow the spread of it. If you're in a private business and stuff, I'm asking you, I'm not telling you, to try to get your people work from home, work remotely. Starting this evening, as much as I hate to do this, bars, restaurants, and nightclubs are once again closed at midnight, and the last call for alcohol will be 11. People, you know the drill, 12 o'clock, 11 o'clock. And you're gonna ask me, why am I doing this? Number one, our police are exhausted. Closing down bars and rustling people at all hours of the night, we need to conserve the manpower. Two, we're trying to stop people from getting too inebriated and forgetting we have a pandemic, getting people in. So last call, 11, and the bar will be closed. So we'll be doing this right now until the 10th of January, but we'll continue to assess and reassess to see what is going on. This holiday season has been very busy, and we need to curtail the social gatherings to the greatest extent reasonable. In our response, we have seen that these are the things that help curtail the spread of the virus. We've done these things before, they work. We know Omicron is going to tear through here. There's nothing we could do about that. But we can slow it down a little bit. So I know it's New Year's, so I have included an exception for New Year's Eve, where the last call for alcohol will be 1 a.m. and all bars will be ordered to close at 2 a.m. We're not putting any restrictions on the churches and places of worship, but, you know, I'm going to be home for New Year's Eve. I'm encouraging you to do the same. If you must go to church, please just be responsible. Wear your mask. Be careful. I know you miss and love everybody around you, but refrain from hugging people, because this thing is just really, really contagious. We've already canceled at least one cruise ship visit to the Virgin Islands over the weekend. Yes, I wasn't mainly eating ham and turkey. I was also working this weekend along with our health commissioner, trying to control what's going on. We have a memorandum of understanding with our cruise lines, and if they get beyond 1% positivity, we shut it all down. They were at 1.19. We closed that opportunity to visit this port. We closed that down. I must say that the infection rate was among the crew, not the passengers. So that's good news. And I couldn't, in good conscience, cancel all of these things without regretfully canceling all the festival events that are planned for next week from January 4th through the 6th. We cannot have people walking around at the fair, interacting. So that's going to be shut down. We'll try to do something later on in the month or maybe in February when things get better. We expect this to last for the next month, this surge. So you're going to see those numbers increase before they decrease. But if we really stick to our strong protocols, I think we can beat it, because if we have these events, it'll be just in bad conscience. They'll end up being super spreaders, because this thing is out of control. It spreads like wildfire. We are also making sure that we stop as much people coming in from the territory to be coming in with the virus. So beginning on Monday, not this Monday, next Monday, January 3rd, all travelers, vaccinated, unvaccinated, vaccinated in the Virgin Islands, unvaccinated in the Virgin Islands, will have to submit a negative test taken 72 hours prior to travel. So if you don't really need to go anywhere, please stay home for the holidays. Don't go anywhere. So remember, even if you have your vaccine card from the Virgin Islands, you still need a 72-hour test. We see this going on for at least the next 30 days. So things I just want to make sure that you're understanding. Remember, today, bars close at 12, last call at 11. New Year's, last call at 1, bars close at 2. That's restaurants, everything. Please don't make the police harass going around closing you. If we have to close you down, we're going to close you down for 30 days. So I'll go to Commissioner Encarnacion now, let her fill you in on some of the numbers we're seeing and where else to get your tests.
Good afternoon, and thank you, Governor Bryan, and happy holidays to each and every one of you. I'll review some of the numbers that Governor Bryan spoke about and, of course, give you some reminders. As of December 26, 2021, a total of 246,706 tests have been conducted in the territory. Of those tests, 8,213 individuals have tested positive. The 7-day positivity rate, as the governor said, is 11.60%, which is an increase from the 1.6% we spoke about last week. The 11.60% positivity rate tells us that out of everyone who has taken the COVID-19 test over the past 7 days, 11.6% have been tested positive. When the positivity rate climbs in our community, it means that the chance of you encountering someone with COVID-19 at work, at church, or a party increases drastically, which is evident in the widespread community transmissions we are seeing right now today. Like the governor said, this is a time for us to really stay home and stay safe. As of yesterday, there are 544 reported active cases in the territory. There are 240 cases in St. Croix, 296 on St. Thomas, and 8 on St. John. 7,581 cases have been recorded, and unfortunately, there have been 88 fatalities. I must note that we have had no fatalities since we started with what we think is the Omicron, because we have not been able to validate, but signs and symptoms show us for sure that we are looking at the Omicron. If you are sick or have been exposed to someone with COVID-19, please call our epidemiology hotline to schedule an appointment for a COVID test. The hotline is open 7 days a week from 8 a.m. to 10 p.m. Call 340-712-6299 or 340-776-1519. You can also schedule an appointment online at covid19usvi.com/testing. Our website also has a list of other providers throughout the territory that offer COVID-19 testing. If you need to go to the emergency room, please call first and let them know that you're having COVID-19 related symptoms so that they can best care for you and continue to protect the other patients and the staff alike. If you're having difficulty breathing and experiencing life-threatening symptoms, please call 911. Although our hospitalization remain low, we typically see increased admissions after an increase in cases. We are monitoring for an increase in admissions and are currently tracking 1 hospitalization in JFL and 3 in RLS for a total of 4 admissions territory-wide. Our emergency rooms are keeping busy and seeing an increase of visits and about testing individuals, and 75% of those that are being tested are showing positive results. And we're seeing those similar numbers through our drive-through at DOH, as well as within our private practitioners' offices as well. It is more crucial than ever for Virginalis and visitors to practice social distancing. Wash hands frequently, wear a mask, and avoid mass gatherings. The COVID-19 vaccine is a life-saving tool. Getting your family, those over 5 and up, vaccinated is easy and free. Please get your boosters if you have already received your initial doses. If not, get vaccinated. Our CVCs will remain open so that we can serve you. The 2 community vaccine centers are, one in St. Croix at the Nissan Pavilion, and in St. Thomas at the Community Health Clinic, which is on the 2nd floor of Roy Lester Snyder Hospital. To keep up with the latest information, including COVID-19 epidemiology and vaccine data, please visit the U.S. Virginia Department of Health Facebook page or our website, www.covid19usvi.com, or for COVID-19 health information alerts, text COVID-19 USVI to 888-777. This all boils down to stay at home, be safe, wear your mask, social distance. When possible, really and truly stay at home, as the governor is saying. If you can work at home, that would be great. Wash your hands with soap and water or hand sanitize. Remember, vaccines are saving lives every day. Please be safe, and God bless each and every one of you, and thank you. Back to you, Governor.
Thank you, Commissioner. We gave a lot of thought to on this week in the bars and New Year's Eve, and businesses making their plans for parties and whatnot, and we really feel we've been reasonable there. We have not decided to close any of the beaches. We need to learn to live with these surges of variants and viruses that are coming in all the time. And as of this afternoon, we have not made any decisions on the reopening of schools on January 10th. As you know, we already have children in school, so we are monitoring that situation closely, particularly mindful of the kindergarten to 3rd grade students who have already returned to their campuses. A large number of our students have been unable to benefit from in-person lessons for the last 2 school years, and one of the things that the president really emphasizes is getting students back into our schools. So we've really been trying, and it has been our mission to find a safe way to return them to the campus. However, in light of some of the decisions we've made and will be making in conjunction with the Department of Education and the Department of Health next week, we will make sure that we come to a conclusion, because remember now we have a higher population of vaccinated people, which insulates us against those hospitalizations and deaths and eases our personnel at the hospital. I want to say a shout out and a thank you to all our doctors, nurses, and allied health people working in the community. Yes, we add this again, but for the most part, people experiencing symptoms, get your Tylenol, get people comfortable, body aches or whatever, and just stay away from people. So we know it's a lot out there. Our police officers are equally stressed having to deal with it. So please, if you must go out, go home when it's time to go home. Wear your mask. A good doctor friend of mine told me, he says, 3 things have to happen for you to get to Corona. First, you got to meet somebody with the virus, right? So if you don't go anywhere, you don't meet any people. He says once you meet them, they have to be, you have to be exposed to that virus. So wear your mask. That keeps you from being exposed. Make sure they wear their masks. Maintain safe social distance. And then 3rd thing, your body has to be compromised with your immune system for you to get sick. So, take your eat your Wheaties, get your vitamins in, exercise, keep your body healthy. So even if you get sick, you'll be okay. I guess we're going to take a couple of questions from the press before we close out here. Susan Ellis, Daily News. Susan Ellis.
Susan Ellis, the source, VI source?
Yeah, hi, Susan.
That's okay. Hi, good afternoon. This transmission isn't very good, so I wanted to clarify a couple of things that you said. Governor, did you say the beaches are or are not closed?
The beaches are open. We've made no changes to beach hours.
Okay, great. And then Commissioner Encarnacion, did you say that you have not verified the Omicron variant in the territory?
That's correct. We sent 84 samples to Yale University prior to their closing because they're now closed for 2 weeks, and all of those were negative for the Omicron and positive for Delta. We have over 80 samples we're waiting for from CDC. We're expected to get that result tomorrow.
And so then are you just kind of assuming that all this jump in cases is Omicron?
Right now, it actually mimics all the other states and territories that have validated Omicron. So yes, we are. And at the same time, we are making sure that we provide as much monoclonal antibodies as possible to ensure that we decrease hospitalization.
To explain monoclonal antibodies.
The monoclonal antibodies is like an antiviral. It actually allows us to increase the immunity level and decrease the severity of the illness.
Thank you.
Thank you, Susan. Daily News.
Hi, good afternoon. I had a quick question. You had kind of briefly talked about the positivity rate for cruise ships and not allowing some cruise ships into the territory if it goes past that 1% rate. I was curious if you can equate to like how many numbers of active cases would that be like on a cruise ship if it went past the 1%, like an estimate, I suppose.
So let's say and Governor, just to remind you, we turned away 2 cruise ships this weekend, unfortunately. One was 1.2%, the other was 1.9%. The one with 1.9%, we're looking at 4,500 passengers, and then of course I think it's about 900 crew, and we had about 28 positives out of that. So we look at that as well as. Well, basically, that's what we do. And then the one prior to that, the 1.2%, I think was very close to those numbers as well. That one, I think, had even more passengers linked to that ship.
Great, thank you.
Thank you. Ernest?
Yes, Governor. Good afternoon. A few questions. The first one being, with the Paxlovid pill, the tablets being approved by the FDA, either commissioner or the governor, do we know where in the process that is? Are they currently available? Do we have any?
So what I can say is that we've already placed our order. Dr. Hunt is working along with HHS. So there's an application that we had to put forward. She is managing that application. It's already been sent. So as soon as it's available, we'll have it on the territory as well as all the other states. So we're ready to receive it.
Yeah, the president also stressed that they're going to be making a lot more home tests available, as well as monoclonal antibodies, and of course, this new treatment.
Okay, the order that we placed, Commissioner, do we know how many did we order?
I can't say for sure, but we've never in the past, Ernest, been short of whatever we've ordered.
Right.
We've always been able to have ample supply. So I'm sure whatever we've ordered right now is enough for what we need. And remember, it's only, you order at first, but then they give you a cadence. So you order like maybe every week based on your usage. And so we'll continue to make sure we have ample supply within the territory.
All right. Relative to the cruise ships, there was one cruise ship that actually stopped in the territory. I think it's one of the largest cruise ships from Royal Caribbean, something of the seas, Symphony of the Seas, I believe. And it actually stopped here, and that cruise ship had 55 COVID positives. Do we have any clear information as to whether anyone of those persons deboarded into the territory when that cruise ship stopped here?
Just for the general audience, as a reminder, when the cruise ship came, I think, and before to them leaving, I think was either 8 or 9 positive. It's when they got to Florida and they retested, it was over the 50. And I think they added a couple after landing in Florida as well. It's hard to say. We didn't do contact tracing. That would be a contact tracing of over 4,500, 5,000 individuals. And so we would have to link with them, and they can tell us exactly who came off board. I don't think that they were in isolation at that point in time. So, and it's very hard to say. Remember, Omicron acts as though you can be asymptomatic today, become symptomatic tomorrow. You test and you're positive. So it's very difficult to say.
The other thing that Dr. Fauci stressed, he said that the reaction time to this virus is quicker. So usually it's like 4 to 5 days. You see people getting sick within 2 to 3 days, and then they also shorten the time of quarantine for healthcare workers. I think from 13 to 10 days it went down to. That's
especially if you're vaccinated.
Right, because it's moving through a lot faster through your system as well. So based on the timelines, I'm just thinking that we're seeing the little holiday partying catching up with us rather quickly. A lot of these are linked to club outings and parties that we've seen on the onset. And then, of course, once you get it, then it spreads all over. And, we expect to see more this week because I know of at least 3 families where at least one person in the family came down with coronavirus at a holiday gathering and was exposed to everybody. Most of those situations, people have been ending up okay, but who are vaccinated or boosted, but some of them actually contracted the virus. And everybody's different. Some people may take 3, some people may take 5 days. Myself, I was exposed this week as well too, had a coronavirus test. Of course, it came back negative, thank God. But we're just being very vigilant, and we're urging the public to do the same.
And if I may add, Ernest, if I may add, it's not just for the younger population. Remember, we're concerned with the vulnerable as well as the older population is included in that vulnerable population. So that's really where our concern is. Those who cannot fight the virus. That's really what we need to focus on.
Yeah.
Okay, some quick ones quickly. So a quick follow-up there. So there may have been spread with that cruise ship. We just don't know, obviously. And we see how the numbers have jumped in St. Thomas, but we can't put a figure on that. We don't know what
They
really
jumped
took
on
place
both
there.
islands, Ernest. They jumped in St. Croix as well too. It's no different.
I know what I'm saying. St. Croix had for a while, but it just rose high in St. Thomas. I was just pointing that out.
Well, Ernest, let's clarify that.
The commission is saying something?
Yes, St. Croix numbers we were decreasing
That's right.
drastically, so we were getting over our Delta, and as the Omicron, or we're thinking the Omicron is here, we're seeing a jump in both of the islands. So it's really a balance at this point in time. So it's hard to say. I know you want to pinpoint whether or not. I hear you, so I'm going right there with you. You want to pinpoint the cruise ship, but you can't at this point in time. It's very difficult to say.
I mean, on any given day,
Okay,
we have 6,000 people on a weekend coming into St. Thomas. So you do your best.
Understood. I really wasn't trying to, I was just trying to get clarification on what was going on there.
I just don't,
quickly,
I'll say it publicly. I just don't really, the cruise ships have been shut down for a year and a half. They've taken a tremendous hit to their business. They're one of our crucial tourism partners. And I just want to make sure that we give them a fair shake. They're under considerable pressure as it is with this new Omicron variant. And I'm praying for them and hoping that they can get their situation under control on board so they don't have to stop sailing again. We have an agreement with them. If they violate, well, I shouldn't say violate, but if their numbers cross that threshold, there's no compromise, there's no conversation. It's just you can't come.
Thanks, Gov. Two others quickly. A clarification on the school opening situation. So you haven't made a decision relative to the January 10th reopening for in-person. You're still looking at the situation.
That's correct. We'll see how this week goes.
Okay.
Go ahead. We got this week and next week to make that decision.
Okay, Gov. And lastly, you know, as you've pointed out, and we all know this, based on three important major research documents there, that the Omicron variant is drastically less severe than the others before it, Delta, Alpha, all of those variants. And as the commission, as you pointed out, Governor, you know, most folks who get COVID-19, over 98% of folks recover well. You have a variant now that is, you know, some 80, 70% less severe, according to those research documents, than those before it. How does that inform your own decision relative to, you know, restrictions, protocols? Yes, it is way more transmissible, but how does the fact that it is way less severe in causing hospitalization and death, how does that inform your decision making relative to restrictions?
You know, last week I had dinner with some really good friends of mine and their parents. And on Thursday, I think it was Friday, a commissioner in Encarnacion called me and told me that I might have been exposed to the variant. Like, if I got COVID, I get COVID. But my immediate thought was, my God, I exposed my friends' parents to this thing. Suppose they get sick. It's a numbers game, right? So in this, we're not watching 600 people, 2 people in the hospital. Okay, we're doing good. But what we really get scared of is, like, because you have so much people with COVID, you're going to have people that are compromised immunes that didn't get a booster or didn't get vaccinated at all, and it's going to reach them. And it doesn't matter what it is, Delta, Omicron, Pi, Sigma, Tau, or Alpha, it's going to kill them. And like, we trying to avoid that. We had enough people die from COVID, more than enough. And, you know, so we made the restrictions light. We're counting on people to be adults. You make that decision and you bring home this variant or whatever to your parents, your auntie, whoever, and they get sick and they die, that's your personal decision. You know, my conscience is clean, but I'm going to try to do my best. Number one, to protect my people. I don't want anybody else to die. And number two, we don't want to wear out the police, the hospitals, because if too many, even if this is light, and too many people get the variant, we won't be able to function. Can't pick up garbage, we can't go pick up people in the ambulance, we can't service, because the people who are going to serve you, they're sick too. So just hold it down for the next 2 weeks, you know, and then this will pass. You know, we'll do something. I promise to inquire and make it up to you. We're going to have some kind of fete to make up for this one thing. We'll reschedule, whatever. But, you know, this is a month. We got about 4 weeks of this thing to deal with it, and I think we're going to be okay. But if we do it right, we could get out with minimal damage. That's all.
And Governor, I think it's important just to add that it's not just a physical illness. Remember, we have been going at this for close to 2 years. It's also very emotionally draining, psychologically draining, and we have to protect ourselves from that environment as well.
All right, Commissioner Gov, thank you.
Hey, thank you, Ernest. I want to wish all of you a very happy and prosperous new year. We've been so blessed in 2021 throughout this pandemic. I mean, with all the things that we had, we're still doing good. You know, our government is here as a resource for you to help you. This too shall pass, God willing. 2022 will be another banner year for us here in the Virgin Islands. We have been here before, and we are much stronger and way better prepared than we were to handle these surges than we were a year ago and certainly 2 years ago. We know what we have to do. We simply have to summon the will to do what we know we must do to keep ourselves, our family, friends, and our neighbors safe and healthy. Until then, be safe, be sanitized, love you, and have a wonderful, happy new year.